Hello, everyone. Welcome to my channel. It's Lady Nephrology. How's everyone doing? It's been such a long time since I've done a video. I think it's almost been 2 years. So please make sure you share, like, and subscribe. And it's good to be back. This channel focuses on health issues, nephrology issues, dealing with women and kidney issues, and like I said, we deal with all things nephrology, and I'm also incorporating all things health-wise with women's health and different issues that women face health-wise. I'm Kenda, nurse practitioner. I've been a nurse for 25 years and a nurse practitioner for almost 12 years. So today's topic is something near and dear to me. It's an issue that I've been dealing with for many years. And like I said, I've been a nurse for 25 years, a nurse practitioner for almost 12 years. And I just found out about this diagnosis, this condition I've been having, which was diagnosed probably 2 weeks ago. And I came into the knowledge of this diagnosis about a month ago. I just go back to my childhood. It all started back when I was about 8 years old. I started having a lot of pain in my legs. So pain and aching in my legs. I remember my parents took me to the doctor. The doctor just told me it was growing pains. So I'm like, okay, fine. It's growing pains. That's fine. And then as I became an adult, the pain in my legs my legs were still hurting, still aching all the time. And I'm like, well, I'm not growing anymore. But my mom said that she had pain in her legs. My aunties always had pain in their legs. So it was just something that I just figured was hereditary. So I just dealt with it and, would take Tylenol, and that was it. Then once I had my son, I was 25. I gained a lot of weight once I had him. And then my thighs got really big, a proportion, and I was able to really see my quads or my kneecap. And then I got a lot of cellulite on my thighs, and that was very shameful. I haven't worn shorts since the age of 25. And I was very shameful of my body, shameful of my legs. I'm like, why did that happen to my legs? And, why did they look like that? Then I realized my mom's legs, my auntie's legs were the same way, really kind of big thighs, cellulite. And it was just, something that I was very ashamed of. And I would go swimming. I would make sure I have cover-ups on. And one time I had my girlfriend, we went swimming, and before I got out the pool, I had her go get my cover-ups. I didn't want anybody to look at my legs. So I've been really self-conscious about my thighs since the age of 25. And like I said, I have not wore a pair of shorts in public since the age of 25. I've always made sure I wear long dresses, capris, long pants, never shorts. I'm going on vacation. It's hot outside. I'm making sure I'm wearing a long dress or something that covers my legs because of the shame behind it. I even tried once to go to a plastic surgeon and she said that there was really nothing that she can do. They can do like lipo, but it would make it worse. So there was really nothing, to do. I exercised, worked out. I've been working out for the past 17 years, exercise, lift weights, squats, lunges. I've done all kind of things, reps, heat things. I've done everything. And it never got any better. Even if I lost weight, I did strength training. I got personal trainers. Like I could never tone my thighs up for some reason. And so it's just been something that, I just had to live with. And then probably maybe 8 years ago, I started getting some swelling in my ankles. So that started about 8 years ago. And then probably about 3 or 4 years ago, I started getting bruising on my thighs, just out of anywhere, bruising on my legs, just out of nowhere. I'm not on any blood thinners or anything to cause a bruising. I didn't do anything to hit my legs, just the bruising just appeared. And my mom also had bruising to her legs as well. So about a month ago, I went to Macy's in the dressing room. And every time I would go to a dressing room, the lights are so bright, so you can really see all your imperfections in your body. So every time I went to a dressing room, I never would just really look at my legs. I would just try on my clothes and see how the outfit looked. But this particular time, which was about a month ago, I really just looked at myself, looked at my thighs, looked at my legs. I'm like, something is not right. And I have to get to the bottom of this. I'm like, this is not normal. I exercise 3 to 4 times a week. I do weight training, squats, lunges. Something is not right. And so, like I said, when the student is ready, the teacher will appear. I really do believe in that. And so I went searching start Googling, cellulite on thighs, big thighs. And when I started Googling that, I found out about a condition called lipedema. Now, I've heard of lymphedema, like my whole nursing career, dealt with lymphedema, but I never heard of lipedema. So I'm going to kind of explain the difference between the two. And once I went down that, I stayed up all night till like 5 in the morning searching about it. And I started reading all these articles about it. And I started, especially in Europe. So in Europe, it's really known in Europe. They have surgeons in Europe and Spain and everywhere that have knowledge about it. But a lot of doctors in America do not know about this diagnosis. They said about 1% of doctors, US doctors, knows about this condition called lipedema. So I decided to make an appointment with the female doctor. I'd never been to her before, so this was my first time. When I met her, I did explain to her I'm a nurse practitioner. So I've been in the medical field for 25 years. I told her about my situation, my symptoms. I've been dealing with this since childhood, but it got worse once I had my son. The swelling, the bruising, the pain, the discomfort, the heaviness in my legs, the cellulite, that it's non-resistant to exercise, So I explained to her everything, and I even told her about the diagnosis. She just looked at me and told me, "You're overweight. You need to lose some weight, and I can start you on Ozempic." And I'm like, "No, this is unacceptable." So I did leave her a bad review that she just wanted to push Ozempic on me and did not listen to my concerns. Because as women, we do have to advocate for our health. So I gave her a bad review, and then she ended up calling back 2 days later. She sent me a research article about it, and she said, "Oh my God, your symptoms in your physical exam, you do have lipedema." And then now she has sent me a referral to a plastic surgeon to talk about it. So I'm going to, with all that being said, that's just the background of my story and the pain I've been dealing with my legs since 8 years old. When I had my son, it worsened, the swelling, the pain, the cellulite, the bruising, and all that. And not having your concerns about your health being heard, and me, especially being in the medical field, but I thank God that she did go back and do the research. And then she ended up calling me back, and she did the right thing. So I'm going to do a presentation about lipedema so people can have a better understanding about what it is. I'm sharing my screen here. All right, so the condition is called lipedema, and I'm going to talk about the diagnosis and management. So what is lipedema? Lipedema is a subcutaneous lipodystrophy, which is basically an abnormal distribution of fat, and it causes lower extremity overgrowth. It is a chronic medical condition characterized by symmetrical, so it's on both sides, buildup of painful adipose tissue in the legs, which is fat tissue in the legs. And sometimes it can be like in your arms, in your lower trunk with your hips, buttocks, and abdomen. And it is different from obesity and lymphedema, but they can occur together. So lipedema is different from lymphedema. So what is lymphedema? Lymphedema is swelling that happens when something affects your lymphatic system. Lymphedema often affects your arms and legs, but may also affect other areas of your body. So when your lymphatic system doesn't work well, your body accumulates fluids and may begin to swell. Lymphedema can also increase your risk for developing an infection in that area where the swelling is. Lymphedema is usually asymmetrical, which is usually on one side of the body, and it can affect both men and women. So now I'm going to go back to lipedema. Lymphedema is widespread, affecting millions of adolescent and adult women, though the prevalence estimates it varies. So the common presentations that you see with lipedema is bilateral, both sides, symmetrical buildup of fat in the legs, sometimes, like I said, in the lower trunk that is resistant to nutritional intervention, exercise, elevation, diuretics, and bariatric surgery. So I have exercised, I've lost weight, I've been on diuretics, I've done, all that, eating healthy, and I can lose weight. And there was a time 2 years ago where I went from 174 down to 147. So I lost about 25 pounds or so. And I lost the weight, but my thighs were still bigger than the rest of my body. But typically with lipedema, your feet and your hands are spared. And it almost exclusively affects women. So it's pretty much a disease that typically only affects women. A lot of complaints of pain. You have tenderness and heaviness in affected areas, and also you can have fatigue. And it starts or worsens at times of hormonal changes. You can get it at puberty, pregnancy, or menopause. And I know I started having the pain in my legs at 8, but once I had my son at 25, that's when it really worsened during that time. Easy bruising is a presentation, presence of nodular and or fibrotic texture beneath the skin that can cause or create an uneven, dimpled appearance. Edema and joint hypermobility may also be present, but not always. So diagnosis. Clinical diagnosis is based on patient history and physical exam. You can also do a lymphoscintigraphy, which is a non-invasive imaging test that uses radio tracers to map the lymphatic system. It can be done with patients who has a BMI greater than 30 to differentiate between lipedema and lymphedema, with or without obesity. You can also do an MRI of the lower extremities to exhibit increased circumferential subcutaneous adipose tissue without evidence of muscle or bone. But usually the diagnosis is based off the symptoms and physical exam. You want to take a history, ask the woman if they, in their family, if they have a similar body type. Like I said, my mom and my aunties, the pain in the leg, the similar body type, the way our thighs are shaped. You want to ask the patient when is the onset of the symptoms or worsening with hormonal changes. Ask about pain or tenderness, heaviness in the legs. You want to ask about fatigue or easy bruising. And then when you do a physical exam, you want to check for bilateral on both sides, symmetrical fat accumulation, which is primarily seen in the legs, the thighs. But the arms, buttocks, hips, and abdomen can also be affected. You want to feel for presence of nodular or fibrotic texture and pain. Also, it's called stemmer sign. That's a test in which you pinch the skin at the base of the second or third toe or finger. Lipedema usually it spares the hands or feet, so that test, the stemmer's test, should be negative. Lipedema is a distinct disease entity. Multiple studies have found significant differences in gene expression and lipid and metabolic profiles. People with lymphedema may appear metabolically healthy, including having lower tendencies to develop diabetes. Unlike obesity-related fat, lipedema fat, it does not respond to nutritional interventions or exercise. It usually does not. When I lost the weight, that fat accumulation around my thighs did not respond to that, and it does not respond to exercise. Like I said, I do squats, lunges 3 to 4 times every week. I lift weights, and it has not responded. Treatment for lipedema. Weight control. By reducing weight, it may decrease the adipose tissue and inflammation. Like I said, when I lost weight and my thigh circumference got smaller, but my legs still remained larger than the rest of my body. And also, you also want to eat a good, healthy diet. And that's whether you have lipedema or not. That's just for anyone. Having a diet to reduce inflammation, making sure you're eating a lot of fruits, vegetables, whole grains, lean protein, omega-3 fatty acids, making sure you get vitamin C, and you also want to reduce your sugar and alcohol intake. You want to do treatment can be complete decongestive therapy, compression garments, really good. I have compression garments that I wear as well. Gentle or aquatic exercise to increase strength, mobility, and lymphatic flow. But the main treatment of lipedema is specialized lipedema reduction surgery, which is liposuction. Liposuction removes the pathologic subcutaneous fat. It can effectively reduce pain and other symptoms, along with it improves appearance and quality of life. After liposuction, patients reported a significant improvement in their physical functioning and satisfaction with their appearance. So here are some pictures of lipedema and the different stages. And this one just goes to stage 3, but in other studies, it can go up to stage 4. And you see how it can progress. And sometimes without it being treated, it can progress and it can end up turning into lymphedema. So that's stage 1 here, stage 2, and then stage 3. So that is the end of the presentation about lymphedema. Like I said, it's really not well known and well studied in America. So Europe is ahead of the game on this. But I'm hoping that I want to bring awareness to that, especially to all women, but especially women of color. Really want to bring awareness to that, to this disease, because a lot of us are suffering in silence and we don't even know what it is. And doctors don't even know what it is and how to treat it. But thank God that I will be getting referred to a specialist doctor in Austin, Texas. He's a plastic surgeon and he deals with lipedema. And a lot of times now insurance companies are able to cover part of it. So that would be great as well. So I want to keep you guys on that journey once I go to Austin next month to have my consultation. I just want to, share that journey with everyone. So if anybody is suffering from this, they can look to this and they can get the help that they need. So the references I used was up to date, diagnosis and management of lymphedema. And then also I used went to the Lymphedema Foundation website and used the clinician's guide to lymphedema. And so those are the references I used for this presentation. So thank you guys for listening. And like I said, I hope you share, like, and subscribe. And if you know any woman who has been dealing with something like this issue, just please send her over to Lady Nephrology. Okay. Thank you guys and have a good day.